See how anyone can afford amazing concierge-style healthcare. Everyone knows what a pain it is when you have to go into your primary care doctor's office. First you call, and when you do get a hold of a live person, they can't see you for 2 weeks. Of course, you might be thinking in your head, but I'm sick now. I can't wait 2 weeks. But you go ahead and make the appointment, and the day finally comes. You take off work or pull the kids out of school to drive over there and be on time. You check in at the desk and they tell you to have a seat and fill out the clipboard stacked with the same exact papers you've filled out every time you've ever been to their office. But you complete it anyway, take it back to the front desk, and then the wait begins. So you're sitting there in a room full of other sick people, wondering how the doctor's office gets away with never actually seeing anyone on time. Finally, they call your name. You head back, the nurse takes a few vitals, and then sticks you in a room and says the doctor will be in there in just a minute. Finally, the doctor rushes in, sees you for all of about 8 to 10 minutes, and then rushes out and sends you off with a prescription or a referral. If that sounds like just about every doctor's visit you've ever been to, you're not alone. The doctors are forced to hurry through patients because that's how the standard health insurance fee-for-service model is structured. Fortunately, many doctors are fed up with the current state of primary care, just as much as you and I. And the even better news is that there's an affordable new way to access concierge-style everyday healthcare with none of the old school hassles most people are used to. My name is Grace Gosnell with the Health Benefits Network, where we give you the scoop on the latest ideas and innovations about healthcare and benefits that can make your life better. Today, I want to introduce you to a concept called direct primary care. In short, it's implementing a membership-based approach to medicine instead of the fee-for-service approach that we're used to. These membership-based primary care practices are changing the game and getting quite a lot of things right when it comes to helping people access great healthcare. First, direct primary care limits how many patients they will take on as members at any given time. While a normal primary care practice might have 2,000 or more patients, many direct primary care practices might cap theirs at, say, 500 to 600 patients. This means way more time available to spend with their patients, researching new treatment options for them, and getting to know the complete overall picture of their health, not just the episodic sickness that brings them in every once in a while. This also means that patients have unlimited access and time with their personal doctor. It's not uncommon for an appointment to last half an hour if that's what the member patient needs. Second, direct primary care practices are able to accommodate same and next day appointments. This leads to members getting medical issues treated quickly and efficiently. Members aren't forced to go such a long time without treatment that something that otherwise would have been an easy office visit now requires a trip to the urgent care or worse. Instead, when members need access to their doctor, scheduling a same or next day appointment is quick and easy. On top of that, there's no waiting room full of other sick individuals and long wait times past the scheduled appointment. Direct primary care practices value their members' time and know they have busy lives as well. Members are seen promptly and on time for their appointments. And because the appointments are never rushed, members have as much time as they need to communicate their health concerns directly to their personal physician. Third, direct primary care offices also offer their members a way to connect directly with the doctor when they can't be in the office. These DPC practices have embraced technology that allows them to securely message, call, and video conference directly with patients. Everyone knows that healthcare doesn't happen between the hours of 9 to 5. Members of DPC practices can communicate with their care team as things happen or when they think of questions. This leads to better two-way communication throughout the entire duration of a healthcare episode. Many DPC practices also perform a great deal of procedures in their office for no additional charge. The services that a direct primary care practice will include will vary, but things like minor suturing, blood draws, EKGs, physicals, well-woman exams, and more are typically included. This goes back to them having so much more time available for each patient that performing minor procedures in the office isn't a problem. Lastly, direct primary care is probably a great deal more affordable than you might think. Every practice will set their own pricing and what that includes. I'll give you a little bit of personal background on my relationship with my direct primary care doctor. Each month, I pay right about $60 for my membership. I live in the Houston, Texas area, but my physician is up in the Lake Conroe area, about 45 minutes away from where I live. Why did I choose one so far away, you might ask? Well, easy. I got to know her prior to joining and really liked her personality and bedside manner as a physician. When you have a DPC doctor, you can almost shop these qualities in one prior to joining. That said, the distance between us is no problem at all. I have complete access to communicate with her no matter what it is that I need. And when I do need to go to her office, it's no problem for me to take the drive out to see her. We may talk about whatever it is that's going on episodically with me at that time, say for example an elbow that's been a little sore when I play tennis, and what I can do to keep that from happening. Maybe perhaps some signs that it's something more serious, and when I would need to get a specialist involved. But since I'm there, we may spend a little extra time together and talk about some supplements I've been thinking about introducing to my diet, or that I've been hearing about intermittent fasting and wondering if that's a good practice to take up from time to time. Because we have unlimited time together, we can discuss any of my health goals and come up with a plan forward. When you think about all of these differences between direct primary care and traditional fee-for-service primary care, it's obvious why so many people are looking to new models as this for better access when it comes to their healthcare needs. To take direct primary care to the next level, many people will choose to leave behind their old, expensive health insurance and instead look to lower cost alternatives, such as medical cost sharing. In this world, members have access to their direct primary care practice for all of their everyday healthcare needs. Then, their medical cost sharing membership is there for the large unexpected health needs that come up in life. The overall cost is typically between 30 to 60% less than what people are paying for a traditional health insurance option. And like we've learned today, the access to care when you need it is night and day better. I've seen all sorts of people and groups switching to this revolutionary combination of direct primary care and medical cost sharing to address their health needs. Families who can't afford their employer's benefits, folks looking to go out on their own and start a new small business, and even established businesses who can no longer afford the rapidly rising cost of traditional health insurance. Everyone has been looking for a better solution to the healthcare problems that face everyday people like you and I. This combination of solutions is doing just that, giving better access to everyday healthcare that we all face, providing peace of mind for the large unexpected events in life, and offering a monthly payment amount that's vastly more affordable. We want to hear from you, so please leave your questions and thoughts in the comment section below. To make sure you enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with your colleagues and friends.